I was one of the healthiest women in Charleston.
When I saw my oncologist for a routine checkup, and he pronounced me the picture of health.
The biggest thing I thought I was going to expect was a hysterectomy.
When we finally decided to start trying to have a baby, we were having a lot of trouble.
I had what I thought was routine hernia surgery, and I came out of that surgery and the physician patted me on the arm and said, "I'm sorry." And the diagnosis was stage 3 ovarian cancer.
3 weeks later, I had a pain in my side, and by that evening, I was in emergency surgery, and I had stage 3 ovarian cancer.
I woke up in recovery and they said, "We found cancer."
They cut out a tiny little polyp, and they thought it was nothing, but they cut it out just in case. I had stage 1 uterine cancer.
The recent statistics suggest that if this year we do not get our vaccination rate of 11 and 12-year-olds up to 80%, which is the recommendation by the CDC, is currently 30%. This year alone, if we don't do that, 50,000 of those children will ultimately die of an HPV-related cancer.
I didn't know anything about ovarian cancer. I thought when I had an annual exam, I was being screened for ovarian cancer.
I knew nothing about ovarian cancer, nothing at all. Had never even considered it as a possibility.
I didn't know a whole lot. I did have a great-grandmother that died from this disease.
I knew nothing and was shocked, absolutely shocked, because this doesn't happen to you, it happens to other people.
Everybody have a seat. I think the first thing, something that we tend to skip over in regular OBGYN is the family history. After you've had your babies, it may seem like that's not really important to other problems that women have older in life, like bleeding or prolapse. And in fact, at that point, that's really when the doctor needs to hone in on your family's history. What is your history of breast cancer? What other gynecologic cancers have you had? And how can those cancers affect your risk? And more importantly, how can you be tested for genetic risk factors for ovarian cancer and other cancers? Hey, Ms. Morehouse, it's good to see you.
Good to see you.
How are you doing today?
Doing just fine.
Good. Do you have any questions for me before we go back to the operating room?
No, I'm leaving it all up to you.
Okay. All right. Well, we're going to take good care of you. Okay? All right. And I'll come out and talk to your family as soon as we're done.
Okay.
Okay? All right. And we'll have all the final pathology in about a week.
All right.
Okay.
And then I would need treatment.
So then after all those specimens are back, then we'll make a decision about whether you need extra treatment or not.
Certainly having family and friends close at hand, and they were so supportive. It's so easy to stay in bed and say, it's just too hard to go forward. And it takes a lot of inner strength.
I had a group of friends, family, mostly women lawyers, who took it upon themselves to make sure I was never alone after my chemo treatments, and we had a lot of fun together.
Just having an environment where I could openly vent about, you know, what was going on with me, and to hear me ask that, why me, why me?
My husband has been a major support through this. I have to say him and my friends and my family and my faith. And wine, of course.
So Miss Marilyn is headed to the operating room now to undergo a robotic-assisted hysterectomy. She has a high-grade uterine cancer, and we're going to do a hysterectomy and remove her lymph nodes. The diagnosis of uterine cancer is on the rise, and we continue to work towards early diagnosis. We want to make sure that these women are getting in and getting surgery with a gynecologic oncologist. There's still, unfortunately, many women in South Carolina who are having surgery for a uterine cancer with their local doctor because the local doctor doesn't understand the extra treatments that are recommended for these patients, including surgical staging and possibly radiation or even chemotherapy, even early stage patients who are considered high risk for cancer recurrence. We've got the robot hooked up and we're getting ready to start her hysterectomy. We're really hoping there's no evidence of disease.
When I heard the words, no evidence of disease, I was like, what do you mean? What am I supposed to do in the meantime?
With this disease, another side effect is that you've never conquered it. I have blood tests every 3 months, and every 3 months I go through the same stress of, will I get a diagnosis of no evidence of disease?
There's always a chance it could come back. at some point in the future. There is no evidence of disease in my body right now, and I celebrate that every day, every morning when I get up.
So just to tell you a little bit about Miss Barbara, she's an 82-year-old patient who had 2 daughters suffer from ovarian cancer, unfortunately, and one has passed away. Her daughter Vicki is a patient of mine, and as soon as she heard that her mother had an ovarian cyst, she brought her straight to me for further evaluation. So we've just finished her laparoscopic surgery, and we didn't find any evidence of cancer, and I'm really excited to share the good news with the family. So it's good news. Good. Yes, almost 100% benign. Yeah, which is great.
That's the word I wanted to hear.
That's perfect. Yeah, we are really, really pleased.
Good.
We are so blessed in Charleston at the Hollings Cancer Center to have phenomenal GYN oncologists working there.
So grateful. You know, why was I the one that was lucky?
I know how lucky I am. I really do.
I have 3 children. They know that mom's a survivor.
So I know your girl stole my thunder, but it is good news. We were really excited. We were really, I was really pleased that it didn't look concerning at all.
I just appreciate everybody. Everybody's been wonderful.
Great, fantastic.
Well taken care of.
Good.
I'm convinced that we can save lives with better awareness and with better education. So we need to break the silence. We need to scream about ovarian cancer.
We know that weight control with a healthy diet and regular exercise is a great way to prevent uterine cancer in most patients. I would suggest that doctors spend more time talking about lifestyle modifications and how those things can really affect your cancer risk.
It's just good to try and get out there and educate yourself as best you can, and to definitely get your yearly checkups from your OB.
Stay strong in your advocacy, because what we need is better detection tools. We need better drugs. We need a cure. We don't have a cure. I know that.
The key is prevention. Not only do we use prevention with pap smears and early diagnosis for follow-up of those abnormal pap smears, but even more importantly, vaccinating our youth, vaccinating our adolescents against HPV prevents not just cervical cancer, but over 20,000 cancers in men and women that are related to HPV. You have been in seminary now for 4 years.
3.5 years.
3.5 years,
yep.
while fighting this cancer and on and off chemotherapy.
Right, and got accepted for a summer internship for chaplaincy this summer, and then
at Roper.
At Roper, and then found out that I had to have treatments this summer. So they agreed to let me come anyway. So I finished a 12-week program in August 15th.
So Vicki has been ministering to cancer patients while being a cancer patient herself. So
it was a blessing.
You're an inspiration.
There are support groups. Become active in those. It gives you something to do that instead of living with, I have this cancer. You have an outlet, and you have people that can actually understand.
I celebrate every day. I'm just so grateful and thankful to be here. And I think it is one of the positive effects, the joys of ovarian cancer, is that you appreciate every day.
It's really awful that I started to look forward to chemotherapy because I could be with my friends. And it really brought us all so much closer.
I'm extremely lucky. My outcome is not like most people's. So I try to remember that every day, and that right there is kind of celebration enough to know that I'm still here.
She's a brilliant doctor and very compassionate and always willing to answer every question that's asked, and never seems like any question you've ever asked was not. I know some of them were really stupid, but she still humored us and answered us.
Y'all are making me blush. Every day I just do what I can to treat them just like family.
Hearing the word cancer is the scariest word, and I was terrified when I first heard it, but I definitely want to be there for people, and maybe that's why this happened to me.
It sounds like a cliche, but it truly makes you think about what's important.
You are always conscious of it, and it's your choice whether you want the consciousness to be up front and center, or if you want to celebrate the fact that on that day there is no evidence of the disease.
at the Center for Women, we understand that for women to be successful, they also have to be healthy. So a lot of times we put our own health at the bottom of the list when we're taking care of a lot of other people and a lot of other things. So our #1 priority is to encourage health awareness. In specific, Lowcountry Women with Wings, a program of the Center for Women, focuses on some health issues that are a challenge to women specifically, particularly gynecological cancers like ovarian cancer and others that are terrible diseases. They're silent diseases, and if we can make people aware of the symptoms and keep talking about that, know your body, know the symptoms, then maybe we can save lives.